A 50-year-old man who is diagnosed with acute tubular necrosis has a blood urea nitrogen of 80 milligrams per dl and a blood glucose level of 99 milligrams per dl. Urine glucose of 3 plus is also reported. What is the significance of positive urine glucose and a normal blood glucose? Tubular reabsorption is one of the functions of the kidney, which means that the body cannot lose 120 ml of water containing essential substances every minute. When the plasma ultrafiltrate enters the proximal convoluted tubule, the nephrons, through cellular transport mechanisms, the active and passive transport mechanisms, begin reabsorbing these essential substances and water. Active transport occurs when the substances to be absorbed combines with the carrier protein, and this mechanism transfers substances across the cell membranes and back into the bloodstream. Active transport mechanism is responsible for the reabsorption of substances such as glucose, amino acids, salts, chloride, and sodium. On the other hand, passive transport occurs as the result of the differences in the concentration or electrical potential in opposite sides of the membrane, which are called the gradients. Passive absorption of water takes place in all parts of the nephron except for the ascending loop of Henle. This part of the nephron is impermeable to water. So back to the active transport. Active transport is influenced by the concentration of the substance being transported. That means it is influenced by the renal threshold of a substance. So in this case, it needs to be differentiated if the patient has exceeded the renal threshold or the tubular reabsorption is impaired. For glucose, the plasma renal threshold is 160 to 180, and glucose appears in the urine when the plasma concentration exceeds this level. So as we know, the plasma glucose of the patient is 100, which is normal. So therefore, the renal tubular reabsorption function of the kidney of this patient is impaired.